Hello. Hello, everyone. Our topic for today is the resilience of the Israeli public and how it's measured. My name is Bruce Rosen from Israel Healthcare Highlights, and my special guest today is Professor Bruria Adini of Tel Aviv University. Welcome, Bruria.
Thank you very much. Nice to be here.
Good, good. So to get us started, please, Bruria, tell everybody a bit about yourself and your background.
With pleasure. I am the head of the Emergency and Disaster Management Department in the Tel Aviv University. And for many years, I've been involved with emergency preparedness of healthcare systems, both in the field and in academia.
Terrific, terrific. So, well, maybe tell us a little bit about what you mean by resilience of the Israeli public.
There are many different definitions for resilience, but overall, what it means is our capacity to cope and function despite a crisis or an adversity, and even emerge from the crisis, not even at the pre-crisis level, even something that being empowered, for example, what we call bounce forward. And this can be on an individual level, on a community level, organizational level, and even societal level.
Terrific. So, tell us about your project in terms of how you measure it and if you want some of your findings as well.
With pleasure. What we've been doing is measuring the level of resilience on all of those different types that I mentioned throughout the different adversities that unfortunately life has necessitate that we cope with. So we started in 2020 with the COVID-19, then we continued during the year of the judicial reform, and we started or continued more correctly in the week of October 7th. And since then, we've been measuring periodically with throughout the war. The seventh measurement during the war was in the morning of June 13th with the Israeli attack in Iran.
Wow. Well, you must have tons of interesting findings. Maybe just give us one or two.
Okay, I'll share some of the important ones. If we thought before, and that was what science said, that we have a negative correlation between being distressed versus maintaining resilience, what we have found is that those two constructs, distress and resilience, can actually coexist. We can have a very high level of distress and simultaneously, despite the crisis, also have a high level of individual and societal resilience. That's one element. Another element which we saw, and again, this we have seen this both during the pandemic and throughout the war, is that the main element that can predict or explain the level of resilience is our hope, which
Hmm.
means if we believe that despite the adversity that we experience at the moment, if we believe that the future holds a better time, a more positive outcome, that allows us to maintain a high level of resilience.
That's interesting. Do you have any data on the resilience in Israel compared with other countries?
Yes, we do, because we not only measure it here in Israel, but also in other places, such as, for example, Ukraine or other European countries throughout the war between Russia and Ukraine. What I can tell you that we've seen that those countries that have the peak of the adversities, they are the ones that actually show the highest levels of resilience. When there is
Hmm.
an existential threat, that's when we recruit all our resources and are able to maintain a high level of resilience, especially societal resilience. What we saw when we compared the level of societal resilience in Israel and in Ukraine, for example, we found that the Ukrainians have a even higher level than the Israelis of resilience.
Wow. Okay. Are there any practical implications for Israel, Israeli society, Israeli government, perhaps your program from this whole very important and very broad set of findings?
Very much so. And I'd like to maybe share two. One, resilience is not static, it's dynamic. which means that we have to invest efforts in order to maintain and ensure a high level of resilience. This is the responsibility of all of us, both the civil society, but most especially the government and the authorities. What we have seen is that there is a very substantial gap, a significantly statistical gap between those that oppose the government versus those that support the government. But we have to understand that the government is actually the rulers and the regulator for all of us. So the government has to take into account these variabilities and speak not only to those who support them, but also provide the needs and expectations of those that are not their supporters. That's one very important, I think, lessons learned. Another one is, and I've said a minute ago, that we found that hope is the most important element in predicting resilience. Hope is not built when we're trying to relay messages such as, "Yeh beseder," it's going to be okay. That does not work. We need transparency. We need to understand that the public is not the problem. The public is actually a huge resource, the main solution for coping effectively with adversities or crises. And that's why we need to maintain the ongoing risk communication and crisis communication with the public, give them the information. They are rational. They will do the right thing if we speak to them in a way that they build trust toward the governments and the authorities, and accordingly will comply with whatever measures are needed.
Wow, that is really interesting and also very, very relevant. This has been a very illuminating interview. Thank you for the interview. Thank you for the work that you and your colleagues have been doing for quite a few years now, and I hope you'll continue to do it for quite a few years to come. Thank you so much.
Thank you, and I hope that we go back to normalcy very, very soon, and may peace prevail.